what I really like is I developed this side chest contour. Now you can see when I pinch, that's really good compared to the beginning. I want to highlight this case because this is a case where the discussion during the consultation is really important. Obviously, he's got a lot of fullness and a lot of bottom heaviness, and that's pretty typical with gynecomastia. The fullness in this bottom part of the chest causes the breast to look more feminine. His nipple position is quite low, really not even on his pec muscle where it would be up here. And he's got some skin laxity issues as well due to the fact that he's had this gynecomastia for so long and has been stretching out his skin. We had a discussion about the different surgical options, and one option to correct all of this, meaning the fullness, the nipple position, and the skin, is to do a mastectomy and move the nipples up to here. However, that would fix the chest, but it would leave him with big scars, and he just did not want that. I mean, you can tell he doesn't have any hair on his chest. Those scars would be really visible. For that surgery to be successful, you gotta be okay with those scars, and if you're not, then you shouldn't do that surgery. My plan of attack is to really try and deproject this chest and do that with a combination of Vaser liposuction and excision of excess gland, but then also to carry it onto the side chest. I'll bring you around. You can see he's got fullness in the side chest as well. And so really it's hard to see where his front chest starts and ends and where his side chest begins because it's just one shape. So really gonna do some liposuction in this area as well to get that down. Do liposuction in here, take out the gland. That will help a lot with deprojecting and start to masculinize the chest. Where it falls short is it's not gonna do anything for the nipple position, and we'll have to see how his skin tightens up. And so these are the trade-offs that come with any surgery, but especially with this type of gynecomastia. He's got a large grade 3, borderline grade 4, but I'm telling you, I think this is gonna be the best option for him to feel more comfortable about his chest without the big scars. Just finished the vasering of this whole left side here. And so what I'm gonna do is now do the liposuction. The Vaser I use to melt the fat. Really gonna do it in 3 sections here. I'm gonna do from here down to really get this in, and then not as aggressive here and the least aggressive here, and then try and hollow this out as much as possible. And I'll have that same philosophy as well when I go to take out the gland as well. So the most aggressive down here, less here, and the least here, because I want more fullness in the upper chest and less fullness in the lower chest. Finished the liposuction part of the case. I got about 800, 850 cc's out of each side. And you can see he's sitting up about 45, 50 degrees. What I really like is I developed this side chest contour. Now you can see when I pinch, that's really good compared to the beginning. But you can see how that sweeps inwards. And you can see overall his projection is better. It's deprojected, but there's still a little bit too much stuff here compared to here and here. I'm gonna go in and just take out a little bit of this tissue here. It will give a better contour and deproject this bottom half even more, okay? So my initial marking for the gland was all the way here, but you can see now, after doing all that specific liposuction, this is where I really need to excise it. And so I'm gonna go in and do that on the other side. about to take out this left side. And when you do lipo in these cases, they don't always come out as one big piece. So I take out what I can see easily, and then I might have to go back and take smaller pieces. But let's take this piece out here. So this is the first piece here. It's actually a pretty good piece and matches kind of this shape that I drew. And you can see this is predominantly gland, a little bit of fat on there, but this is really the gland here that I want to take out. I'm going to sit them up and then see if I need to contour it down more, but in these cases, you don't want to over resect and be over aggressive because you'll crater them. That's the left side right there. So I just finished this very difficult gynecomastia surgery. This patient's essentially a grade 4, large grade 3, and I've got him sitting up about 45, 50 degrees. I got about 1,600, 1,700 cc's of fat liposuction. And what I want to point your attention to is the contours now. You can see now this contour is so much better than the before. There's no more bottom heaviness. I lipoed the side chest to bring that in, and that's going to be nice and frame out the side chest and differentiate it from the front chest. And then here too, making sure that I don't just take everything out and leave them hollowed out. So I differentially took out more as I went down, so it's fuller here and then flatter as you go down. And all through this little incision. Now, he probably would have been a better overall candidate for a double mastectomy with free nipple grafts, because really his nipples need to be kind of up here. This is the bottom of his pec right there. That scar was just not acceptable. And so in these cases, you have to make concessions, and the concession here is we just have to see how his skin tightens up and he's not going to get the nipple in the right position. But to get away with a much better chest shape through these little 1-inch incision and a tiny one here for the lipo, I think that that's the perfect situation for him. Now I'm going to get him in the dressings. In these cases, I do a lot of foaming and taping down for a long time to make sure that that skin has the best chance to tighten up. And then he'll be obviously in a compression vest for about 4 to 6 weeks. So going to do all that, get him in the recovery room. Until next time, guys.